Do you know what an operating room nurse does? Do you think that OR nurses are just like what you see on Grey's Anatomy, where the OR is dimly lit to add dramatic effect? On Grey's Anatomy, you rarely see the nurse. You see the surgeon barking, "Scalpel!" The only part of the nurse you see is their hand as it's passed to him. In reality, that's not how it works at all. In fact, as a nurse, I'm the one who's most likely to save your life. How is that, you ask? The surgeon is the one doing the operation, isn't he? Well, yes and no. From the time a patient arrives in the OR, the circulating nurse has already reviewed the medical record and is thinking about all of the interventions that will be necessary for a successful outcome. They've assessed any potential complications, and they have a plan for what to do if something goes wrong. They are responsible for all medications given to that patient while they're in the OR, knowing if there are any potential allergens, and making sure that the right patient is having the right procedure and that the patient understands what they're having done to them. Did you know that once you're under the influence of anesthesia, that it's the nurse that makes sure that you're safe? Anesthetized patients can't move or talk. Nurses make sure that you're protected, your skin is protected from potential burns and from pressure ulcers. We take precautions that you don't get potentially life-threatening blood clots. If blood has to be administered, that's a nurse's job too. Your airway has to be protected because, let's face it, oxygen's kind of important. The operative site must be prepared for the surgeon, and you guessed it, that's probably done by the nurse too. Hair must be clipped and the skin must be cleaned. Knowing which skin prep is the right one to use and how to aseptically apply it is what the nurse needs to know. Did you know that some skin preps are flammable, and if surgery begins too soon, that the patient could be seriously burned? Nurses know this. Oftentimes, the patient arrives in the OR, the nurse prepares the patient, helps to anesthetize that patient, prep the surgical site, drape the OR site, and wait for the surgeon to arrive. During surgery, nurses are managing instrumentation, vital signs, documentation, medication, sterility, patient safety, students, residents, pagers, consents, complications, and any contraindications. As the OR nurse, did you know that I've hand-selected every piece of equipment and every instrument that will be used in your surgery? I've inspected it to make sure that it's sterile. I protect the OR sterile environment from becoming contaminated by anyone and anything that enters the room, and that includes protecting you from your surgeon. I have to know what your surgeon will want or need before he does. The scrub nurse works with one surgeon in the morning, yet is expected to know what a different surgeon will want or need after lunch. Many scrub nurses have been in the OR longer than some surgeons have been alive. They have done countless procedures and could set up these cases in their sleep. We are experienced and have a sixth sense when things are about to go bad. We enforce policies that have been created because of our previous experiences. We prevent wrong site surgeries because we follow those policies. We are an advocate for our patients when we see that a surgeon is too tired or stressed out by staying focused on what our patients need and always keeping them in the forefront of what we do every day. At the end of the surgery, while the surgeon goes out to tell the family that their loved one will be okay, a nurse may be the one that's closing that wound, taking the same care that the doctor would to care for that patient. In the past, when you've gone in for surgery, have you considered that there was a patient on that OR table just 30 minutes before you got there? Think about that for just a minute. Just 30 minutes prior to laying down on that table, another patient was lying in the same spot. It's hardly enough time for the table to be cold. There could have been blood, guts, or who knows what else all over that room, but a nurse is the one who cleaned it before you got there to make sure that pathogens can't find their way into your body and create a surgical site infection. So when you decide to have surgery and you ask around for who's the best surgeon, it's certainly something to consider. For our part in the OR, surgeons can have all the glory. We nurses will take pride in the fact that they are the best because of us.